Hey guys, so let's do some practice questions over respiratory. So the purpose of these questions is to help you to start to jump into not only just getting deeper into this content, but learning how to bring together information, how to process it in situations, and start to understand kind of what kind of questions might we ask on an exam, how to approach them. So I'm going to teach you some test taking strategies as well as teach you some ways to look at questions in a different way, to process information, to kind of go about these questions, and then maybe also reinforce some content along the way as well. Sorry, I feel like there's a hair in my face. Excuse me. All right, let's go. Eventually. I don't know why it never wants to click off that first PowerPoint slide. Let's go. First question. So this question says, a nurse is caring for a client with asthma. Which assessment finding is most consistent with this diagnosis? So this is a question, and we can ask this in both ways. We could ask, hey, a nurse is caring for a client with asthma. What is consistent with this diagnosis? We could also ask, what is a sign of a problem? So this is why it's really key as you're studying with these disorders is that you are trying to not only look at what's expected, but what's the sign of a problem, and not just anything like, for example, let's say like we were talking about pneumonia. Like, if they were like showing like worsening signs, maybe like worsening shortness of breath, a new fever, something like that, that would always be signs that they're getting worse. I need to know, like for example, in your book, it might just list the complications that can happen. Like, oh, here, I'll give a better example. Let's say, for example, that I was looking at what can happen after a thoracentesis. So one complication that can happen after a thoracentesis, which is where they drain fluid off of the lungs, is that they can have a pneumothorax. So I could sit there and read the book and be like, oh, I could put on a flashcard. Okay, watch for pneumothorax. But if I don't know what that looks like, it's not very helpful. So in other words, I'm saying when you're studying, make sure to be looking at not only just what's expected for this patient, especially because as we get into other topics like cardiac, my favorite, we're going to talk about like patients like heart failure that they look really sick, but there's things that are expected for them. So I always need to know, even if there's a symptom that sounds kind of scary, I need to know what's normal or what's expected versus, hey, this is a problem or I need to look further into this. So anyway, so this question is asking what's consistent or what is expected. And so when I'm looking at this, I'm going to start kind of going down and kind of going through. So I always like to read the question, reword it in my own words to really understand what it's asking me. So I'm pretty much looking for what is expected for asthma. So would I expect them to state that they are experiencing chest tightness? Well, that sounds right. They kind of feel that like constriction or chest tightness as a result of their inability to breathe. So I like that answer, but I need to check the other ones because this question, if I go back to the question, it says most consistent. So there might be answer choices in here that are more general. There might be answer choices in here that are true for other disease processes. I need to make sure that I'm finding what is the best answer here, because this is not just asking what is consistent, it's saying what is most consistent. So it's saying that there could be more than one right answer here, and I have to differentiate that. Oral temperature of 100.4. So that is a fever per most people's standards. But I'm not really thinking asthma and fever is not really that kind of process. What do you call it with asthma? Decreased appetite and weight loss. That sounds like COPD. Asthma is not usually something where they have changes to their appetite or weight loss issues. So this is another thing you always want to look. A lot of times when you're doing questions like these, it's great. Like a lot of students don't do this. They just try to find the right answer. They read the rationale and move on. But it's really helpful when you're doing questions like this to look at the other answer choices, because sometimes they're the wrong answer for this question, but they're the right answer for something else you need to know. So it's really helpful to look and to see, oh, okay, what do you call it? This is going to help with kind of like not ruminate, but like run through in your brain some other stuff that you need to know. So in other words, while you're studying this question, you're learning about asthma plus COPD. So take time when you're studying these to really look through. And like, for example, assessment finding consistent with this diagnosis for B, oral temperature of 100.4. Well, that might be someone with an infection like tuberculosis or pneumonia and stuff like that, or influenza. So I can sit here, even though I know it's not the correct answer for this question, I can go through and use the other knowledge I have to study for the other topics. And there's D, the client has coarse lung sounds in bilateral lower lobes. Um, and so for this one, that's wet lung sounds. So with wet lung sounds, if I remember correctly, asthma is a constrictive airway disease. So that's one where there's narrow airways, and narrow airways, there's wheezing. So I don't think they're going to have coarse lung sounds. Those are usually a sign of infection or fluids. That would be like pleural effusion. That would be like pneumonia, that kind of stuff, or tuberculosis possibly. All B, C, and D all seem to apply to other respiratory disorders. The only one that really has to do with asthma is going to be A, and that is the correct answer. So I hope that helped. Let's see. Number 2, a nurse is caring for a client with suspected tuberculosis. Which order should the nurse complete first? So this is a question that's looking at you to understand what's the priority or first thing you need to do. And when you look at a question like this, you want to think about which thing, if I don't do, can lead to the highest chance of consequences, problems, issues. And so and the other way of looking at it is which of these interventions is going to have the most direct or most helpful effect for this patient, like is going to give the most immediate need. So that would require me to know what tuberculosis is or what's helpful for it. So I know tuberculosis is an infection. I know it's I won't say very contagious, but it is contagious. It's airborne. So I know that, that it's important that we're trying not to spread it. And I know that they have to take medicine for a long period of time. So I've got a couple ideas in my head, but let's kind of go through this. So the first answer choice is normal saline at 100 mils per hour. Well, they may be dehydrated. I know that they can have some like weight loss with tuberculosis, but I don't really know that normal saline isn't necessarily the first thing that we need to do. It's possible, but there's no signs of dehydration, anything like that at this point. Mantoux skin test. So this is, one of the diagnostic tests, and I definitely do want to confirm it, that they have tuberculosis or not. But if I know anything about diagnostic testing for tuberculosis, I would also know that this is not the most accurate test, and a patient can have a positive Mantoux test but not have active tuberculosis. The only definitive test for tuberculosis is going to be a sputum culture, and those take multiple of them over a period of usually days to weeks in order to fully get back. So this doesn't seem like something that's going to be very helpful to get back right now. Even though it's probably something I want to do fairly soon, it's not something that's going to be as most helpful. Because even if I get this, if I know anything about this skin test, like I can insert it, but it's going to take 2 days for the results to show up. So it doesn't really seem like it's something I want to do first. Because when they're talking about first, they're talking about something that's going to really help you right now with this patient. Acetaminophen, 650 milligrams PO. So they could have a fever. It's common with infections to have fever, but it doesn't really sound like something life or death. I can't imagine them being like, oh my God, patient has tuberculosis, get the acetaminophen right now. So it doesn't really seem like something that's like top of the list for them. It's Tylenol for those that don't know. So, the Tylenol, it seems like something they might not need, but not necessarily like priority. So now I'm kind of like the only one that's kind of sticking around is A so far with me. Then place the client in a negative pressure room. Now, this is one that kind of has to do with some of those ideas I told you about before, where I was talking about how important it is to get them in isolation because they can have very serious issues with spread. There's very serious issues with spreading tuberculosis because it can be like a health crisis, and we definitely don't want to be spreading it around the hospital. So going back to what I said about what's going to be the most directly helpful, or what is going to, what if we don't do is going to lead to the most problems. D sounds like the best answer, because if we do not put them in a negative pressure room, then they could spread tuberculosis to other people. And if we do put them in the negative pressure room, it's going to most directly help to stop that spread right now of that tuberculosis, whether they have it or not, because we don't know that they have it. It just says suspected. But one of my top priorities is infection management, or preventing that from spreading. So, and D is the correct answer here. The normal saline, they may need it, but it's not going to be as priority as getting them in a negative pressure room. All right, question 3. A nurse is providing discharge education to a client with allergic rhinitis. Which statement by the client indicates teaching was effective? All right, so I could, if I was a student who read through this and read all the answer choices, I could get really overwhelmed because I'm already seeing some medication names in there, and oh my gosh, what if I didn't make flashcards for all of them? But really, this is testing my ability to understand, know what to do for allergic rhinitis and know how these meds are supposed to help. And a lot of medications for allergic rhinitis are going to be, are they here to prevent, or are they here to treat? And that's a lot of what this question's asking. And I only know that because I wrote it. But let's go ahead and kind of go through this. So discharge education, allergic rhinitis, And oh, real quick, this question saying which statement by the client indicates teaching was effective. So it's really important for questions like this to always make sure that you know, are you looking for what is right or what is wrong? And so this is looking for what is correct. So like which one of these statements is true? So I'm really looking for the true statement. So the first one says, I will take my cromolyn nasal spray if my symptoms develop. So this is saying, do I use cromolyn nasal spray to treat acute allergic rhinitis? And I think that a lot of the nasal sprays are preventative instead of treating. So I'm going to say I don't think so for that one, but we'll keep it on the back burner. I will take my diphenhydramine, which is Benadryl, prior to being exposed to my allergen. Well, that sounds pretty good. I know Benadryl can help treat allergies. I think it can help prevent them too. So that sounds pretty good, but let me see what my other choices are. I will decrease my fluid intake to decrease my nasal secretions. Well, I remember my professor, Professor Woodruff, said that fluids are really helpful for these respiratory patients. They help to thin out secretions. So if I'm having a problem with secretions, I would think decreasing fluid intake would actually make it worse. It'd make the secretions thicker and harder to get out. So I don't think that that's going to be helpful. So I'm going to say no to that one. I will stop taking my Montelukast if I experience nausea. So this is your like Singulair or your LRTAs, if I know these. You know, let's say that you're like really getting stuck here and you're like, oh my God, I don't know any of these meds. I didn't have time. I spent so much time studying my bronchodilators. I forgot about these. So one thing to kind of keep in mind is there's very rare time where we're going to tell a patient to stop taking their meds. Like we never really tell them like, hey, yeah, stop taking that if you're having side effects. We always tell them to call their doctor to let their doctor know. But we never want to stop taking any medicine suddenly, especially with this medication that can have some really serious side effects. So like you can already kind of cross out D because we never tell patients really stop taking your medication. Now, don't quote me on this in further classes. I cannot control what other professors do, but generally we never instruct patients to stop taking a medication as the nurse. They really should discuss that with their doctor. So I kind of crossed out C and D and now I'm down to A and B. And another test taking strategy here is kind of looking at both of these are talking about whether something is preventative or helps to treat. Like, can I take it? Should I take it before or after? So sometimes when there's two answers that are similar, one is correct. Not all. I know I also said that there's another rule that if two answers are opposite, that one is sometimes correct. And a lot of people find that confusing. Like I said, it's a world of very, very, very gray in nursing. So just know that these are not like always rules, but a lot of times when there's two that are similar like this, they're trying to see if you can differentiate. So I'm going to go with B, that I'm going to take my Benadryl prior to being exposed to my allergen, and that is correct. The cromolyn nasal spray, that is something we take preventatively. We don't take it after. We can take it before the seasonal allergy, the allergy season starts. We can take it prior to being exposed to an allergen, but we don't take it after. It doesn't treat, it prevents. Diphenhydramine or Benadryl can be used before getting exposed to an allergen. So like I had a friend who had really bad allergies, and she would always take Benadryl before coming over and hanging out with us. And then, like I said, the other two, we want to increase our fluid intake and we never want to stop taking any medicine suddenly. Number 4, a client with a right pleural effusion just returned from a thoracentesis. That's a needle aspiration where they remove fluid, if you didn't know. So which assessment finding would the nurse need to report immediately? So this kind of question is looking to try to see if you can identify which is concerning or which is a sign of an adverse event or complication. And so this kind of goes back to that thing I mentioned in the beginning of this video where I said it's really important to not just know what's expected, like, because there's some stuff that can happen after procedures that's not great, but it's not necessarily a sign of something I need to do. But saying I need to report immediately, this means this could be a crisis or a very serious issue. But so effectively, again, like I would have to know, I kind of brought up like with the thoracentesis that they could have like a collapsed lung. I could say, oh yeah, their lung could collapse, but do I know what that looks like? Because in a question, we're not going to usually be so specific that we're going to say, oh yeah, their lung collapsed. We're going to give you signs of a collapsed lung and expect you to be able to see that. And especially as you get into further classes and complex, you're going to be expected to go way more in depth with these kind of things. So anyway, let's look at some of these choices. So after getting a thoracentesis, would I expect them to complain of mild pain, 4 out of 10 at the procedure site? Yeah, probably. You know, once the numbing medicine wears off, having some mild pain, that's not too bad. Client has diminished breath sounds in their right lower lobe. Well, that's where their pleural effusion is. So this is the tricky thing here, is that I know I've been talking about this collapsed lung thing, and people are like, "Ooh, diminished breath sounds, that's collapsed lung." Decreased breath sounds or absent breath sounds are signs of a collapsed lung, but diminished breath sounds are actually very common with a pleural effusion. The fluid is effectively, it kind of like mutes out or numbs out the sound, so you can't hear it. So it's diminished. It doesn't mean that it's gone. It just means it's more, I think diminished, think it's more like kind of weak or hard to hear, because you're pretty much, when you put your stethoscope over those areas where there's a pleural effusion, you can't hear anything because there's fluid there, not airspace. So diminished is actually expected for a patient with a pleural effusion. Client has an oral temperature of 99.6. Well, that's not a fever. It's mildly elevated, but they might have that. They have some inflammation, other things going on, and pleural effusions can sometimes have infection, other things in them. So I'm going to say, I mean, that doesn't sound like, oh my gosh, I need to report this right now. Again, this question, when it says report immediately, this is something like, if I don't report this, the patient could die or something serious could happen. So I need to figure out which one of these, if I don't report it, something super serious can happen. My last choice is client has a blood pressure of 90/55. So this is the only one that really sounds concerning to me. And if I knew anything about thoracentesis, I know that they're taking fluid off of the patient's lung. And as a result of that, because of that fluid loss, they can have hypotension. It's a common complication, but we definitely need to do something about it. So the correct answer here is D, that low blood pressure, because that is going to, I need to report that immediately. Now, do I maybe need to do something about the other things? Yeah, I'd probably maybe need to treat their pain. If their temperature gets worse, I would need to treat that. And I definitely need to keep an eye on their breath sounds and make sure that they're just diminished and that their lung is not collapsing, et cetera. That's expected. It would depend on what they were before, but the only thing that requires me to do something right now is going to be that low blood pressure. Let me do this next one. Hold a second, I'm gonna get some water. So this one says, what instruction is most helpful for a client with COPD to increase their nutritional status? So this question is saying, first of all, it says the word most helpful, which means all of these answers might be helpful in some way, or there might be more than one right answer, but which one's going to be most directly or most helpful? And it's for a client with COPD. So you always need to look at what disease process. A lot of times students will read really quickly and they'll find an answer that sounds like something they heard their professor say over and over, and they'll be like, oh, this is it. But it has to be right for this disease process, and not just for this disease process, but what for this disease process is to increase their nutritional status. So my correct answer has to be related to increasing their nutritional status, not just helpful for COPD in general. So the first choice is encourage client to eat foods high in fat and carbs to increase weight. So I know they have problems with weight, but I thought they wanted to increase calories and maybe protein. I don't know about high fat and high carbs. That doesn't sound necessarily to be the most helpful, but it's possible. I do like it somewhat. Answer choice B, encourage client to take albuterol prior to eating to improve their activity tolerance. Okay, well, that sounds good. I mean, I know you can take albuterol prior to like exercising. And since for patients with COPD, like eating is kind of like exercise for them because it takes work, because it's hard to eat and breathe at the same time. I mean, I like that. So far, that's the answer I like the most. Answer C, encourage client to eat larger meals in the morning when they have more energy. So if I remember correctly, I do not want them to have large meals. They can't really tolerate that, small meals throughout the day. And I think we also teach them energy conservation. So we don't want them to overload themselves at one time. We want them to spread out, all their activities throughout the day. So I don't really like that. So this is also one of those things I talked about in another video about, we don't like extremes. And so usually like when we're talking about I don't think there's anything, I was like, any disease process where I want them to have large meals. Like it's almost always smaller meals or spread 6 meals throughout the day. I don't think there's any disease process we learn about where we're like, eat a large meal. So generally that's kind of a cue for you. That's probably not the right answer. It's also an extreme, like, hey, it would be the same as if I said, hey, do all of your activities in the morning first thing. Like, I mean, that's usually not going to be helpful. They're going to be worn out, not be able to do anything the rest of the day. The answer choice D, and so I don't like C, I'm going to cross it out. D is encourage client to increase fluid intake to help thin their respiratory secretions. Well, this sounds great. Like I like this. And my professor said this so many times, fluids, thin out those secretions. But then I have to go back to the question, because if I have two answers that I think might be correct, if I like B and I like D, I have to see which one most directly answers the question. So this question's asking what's going to help to increase nutritional status. Taking albuterol prior to eating can help to allow them to eat better because they can breathe better. So therefore, they're going to be able to maybe eat more because they can breathe and eat at the same time a little bit better. Increasing your fluid intake, that's great for COPD in general, but is that going to help increase their nutritional status? Drinking more fluids, like, and I think I remember my professor saying something about not taking fluids with meals because they'll fill them up super quick. So we do want them to increase their fluid intake, but for this specific question, when it's asking about what we're going to do to increase their nutritional status, the best answer here is going to be B. Sorry, I've done too many of these videos back to back, and I lose my voice eventually. Believe it or not, I know it seems like I talk effortlessly, but it is a little exhausting after a while. So yeah, so A is not correct because we want that high calorie is what we want. We like moderate fat, moderate carbs to help with their weight. The larger meals is not helpful because then, like I said, they'll get tired out. We want small meals throughout the day. And then we do want them to increase their fluid intake, but that's not going to help with nutrition. That's just going to help with their COPD in general. So the best answer here is going to be B. So client with a severe hypersensitivity reaction to peanuts is in a state of anaphylaxis. What priority intervention should the nurse should be implemented for this client, select all that apply. So this is your favorite. So like I mentioned in other videos, the second you see that select all that apply, you go into panic mode. You're like, oh my God, it's a select all that apply. So a half of the battle of select all that apply is learning to be okay with the anxiety, learning that anxiety is going to come, but you don't have to freak out or die when you see it. Because these questions, like, as long as you're like, oh my God, I'm not good at these questions, you're not going to be good at them. And as long as you kind of like put yourself in a state of like, hey, I'm going to fail, then it's going to always end up like you feel like you're going to fail or you end up failing. So, part of the battle is just not playing games with these. So what I recommend with these is read the question. 9 times out of 10, it's going to be a straight up knowledge question. This is asking for priority interventions. So some of these might be stuff we do later. It's saying, what are you going to do first or right now or what's most important? But most of these are going to just be knowledge questions. So it's just true, false. You start at the top, you say, okay, well, true or false for A, true or false for B, etc. And then it's really important not to play any games. Once you select your answers, stick with them, writings on the wall, do not try to change them or say, oh, well, it should be at least this many. The general rule here is that in our exams here, we're going to have at least 2. It could be all of them. On NCLEX, I think it can be 1 or all. So just know that for the future. But effectively, I just need to go down to true, false, not playing games saying, oh, it has to be like, oh, I only chose 2. It has to be 3. Or, oh, no, it can't be all of them. No way. So don't play too many games. No, in general, it's usually for us, like we usually choose at least 2. Well, we always choose at least 2. And we usually don't choose all of them, but it's always possible. We like to throw those curveballs. So let's go down here. So I have someone who's in anaphylaxis. It's saying, what am I going to do to treat anaphylaxis? Am I going to apply oxygen via nasal cannula per order? Yeah, there's an oxygenation issue here for sure. So I need to get that done. All right. So I'm going to say true and move on to the next one, not going back and second guessing myself. Administer epinephrine, IV push. Oh, absolutely. That's my first thing I want to do. They need that epi. That's going to open their airway because that nasal cannula is not helpful at all until I open their airway. So I'm going to say yes. Administer Zeroflucast. So this is another LTRA like montelukast so that's going to be like preventative for allergies. While obviously they're having an allergic reaction, I don't think this is going to help because this doesn't treat allergies. Excuse me, it prevents them. So I'm going to say no to this one. Administer normal saline 100 milliliters per hour. Yes, I know that they can have vasodilation with anaphylaxis, so we do need to replace fluids. So I'm going to say D is yes. And then last but not least, administer prednisone IV push. So I'd have to know what prednisone is. And a lot of this question is really just seeing if you know your meds or you know your treatments for anaphylaxis. This is just a knowledge question. And so prednisone is a steroid, and I know that steroids do help decrease inflammation, which is super helpful when I'm in a state of anaphylaxis. So I'm going to say true. And so the correct answers here are A, B, D, and E. So you see, I kind of choose them. I am set in my answers and I move forward. These are usually not meant to be tricky or not set up as tricky, but you just need to make sure always that the whole answer is correct and that you know what the question's truly asking you for. Because that's, if you ever you're like, wait, I think all of them are correct. Well, go back and read the question and make sure that you really understand what it's asking you. But yeah, so A, B, D, and E is correct. So, and real quick, just to kind of go over that, like, so with this patient, usually what we're going to do is they're going to get their epinephrine to open their airway. We're going to apply oxygen to help to improve their oxygenation. The fluids are going to help to replace, because they can have like that vasodilation, low blood pressure. The steroids are going to help to decrease inflammation. I might also give things like diphenhydramine or Benadryl to help with some of the allergic reaction. They might also get albuterol to help open their airway as well. Then just frequent blood pressure, heart rate checks, monitoring their airway over and over. Just know that once you give the epinephrine, their swelling can come back or get worse. So they sometimes need more than one dose. So just be watching their airway closely. All right, last but not least, question 7. A nurse is assessing a client with influenza. Which assessment finding would indicate the client's condition is worsening? So this is like the opposite of that first question where I was asking you what's expected. This is saying, how do you know it's getting worse? And so this is where I was saying you have to understand not just like, okay, well, what's a complication of influenza? If you had on a card, okay, here's all the complications of influenza. Well, great, but do you know what they look like? Because again, here, look at these answer choices. These are asking you to tell, these are asking you to figure out what the actual what the actual complications are going to look like. Because as the nurse, I could sit there and know, hey, a complication of this disease is this, but if I don't know what it looks like, how am I going to be able to tell the doctor, hey, they're having a complication? So in other words, I'm recommending when you study, not just to study the names of the complications, but study what they look like. What's going to happen in the scenario? How am I going to know they're having this complication? So most of the time in a question like this, the other answer choices are going to be answers that are similar, sorry, not I don't want to say that, answers that are expected for a client with this disease process. Oh, sorry about that. So pretty much what it's affecting, what it's trying to get you to do is differentiate what's expected and what's a sign of a problem. So that's why I really recommend with students when you're studying on your concept maps, other things that you are trying to differentiate what, make like a differentiation. Okay, here's what I'm going to see and it's okay. Here's what's not okay. So with influenza, would I expect them to have a painful sore throat? Well, yeah, that sounds about right. They can have a sore throat with influenza for sure. Audible crackles in bilateral lungs. I don't know if I like that. Influenza is an upper airway thing. I don't think they should have lung issues. So I'm going to hold on to that one and come back. Chills and a temperature of 101. Well, I don't like that because that sounds like they got a fever, but are they expected to have high fevers in influenza? And I think they are. So that sounds like something that I could expect. Then D, client has an oxygen saturation of 95 on room air. Well, that's normal. So you can see here, there's a couple like A and C are both signs that are kind of expected with influenza. They sound kind of scary, but that's what you always have to know what's scary, but maybe what's expected for a condition versus what's a sign of there's a problem. And then D is just throwing in there to see if you know what a normal oxygen saturation is. So they have a normal oxygen saturation, no issues there. So then that only leaves me with B, which is my correct answer. But just to better understand this, a complication of influenza would be pneumonia. And so this is a sign of pneumonia. So influenza is an upper airway issue, and a lot of students don't know that. They think it's a lung problem, but the flu is actually an upper airway issue or upper respiratory issue. And so if they're starting to have abnormal lung sounds, decreased oxygenation, difficulty breathing, that's a sign that they're getting worse, and that we should start to have more concern for them that they might be developing a secondary infection or getting a pneumonia. So the correct answer here is B. You always want to look for those signs, again, that things are worse. Anyway, hope this helped, and I'll see you guys for the next one. Bye.